Good evening, everyone. Welcome to DIKSHA Academy. Our speaker will be joining us shortly. Good evening, everyone. Our speaker will be joining us shortly. Sorry for the inconvenience caused. Good evening, everyone. Our speaker will be joining us shortly. We are extremely sorry for the inconvenience caused. Thank you for patiently waiting for us. Good evening, ma'am. Good evening, ma'am. Can you hear me, ma'am?
Good evening, ma'am.
Welcome to DIKSHA Academy, ma'am.
Good evening.
Ma'am, we'll be having introduction, ma'am, and then
Yeah.
we'll be handing over the session to you, ma'am.
Yes.
Shall we begin now, ma'am?
Yes, sir. Yes, ma'am.
Thank you so much, ma'am. I'm handing over to Shivani now.
Good evening, everyone. Quoting Nelson Mandela, the greatest glory in living lies not in never falling, but in rising every time we fall. With great joy and immense pleasure, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. Sudhir Raj Memorial free webinar series organized by DIKSHA Academy in association with Ayurveda College Coimbatore. In today's session, we'll be discussing about Artavakshaya and its Ayurvedic management by Dr. Ayare Kalpana Bajrang.
Thank you, ma'am.
Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised, posted in the chat box. Questions raised will be cleared at the end of the session.
Am I audible?
Next, I would like to invite Dr. Vandana
Yes,
Ma'am,
ma'am.
Associate Professor, Department of Prasudi Tantra and Sri Roga, Ayurveda College, Coimbatore, to deliver the welcome address.
It's a great pleasure for me to introduce our guest speaker, Dr. Kalpana Ma'am. Ma'am completed her UG from Saint Govindaji Rauji Ayurveda College, Solapur, Shivaji University, Kolhapur, and PG from SVNH Ayurveda College, Rahuri University from Pune. She also did her PhD from Maharashtra University of Health Science, Nasik. Ma'am had more than 14 and a half years of clinical experience and has guided 11 PG students, and now 6 students are doing PG under her guidance. She has presented several papers in national and international seminars. She had published 19 articles in peer-reviewed journals. Currently, ma'am is working as Associate Professor, Department of Prasudi Tantra and Sri Roga, Sumitibai Shah, Ayurveda Mahavidyalaya, Pune, Maharashtra, India. Let me call Dr. Vandana Ma'am, Assistant Professor, Department of Prasudi Tantra and Sri Roga, Ayurveda College, Coimbatore, to deliver the welcome address. Over to you, ma'am. Dr. Vandana Ma'am. Am I audible, ma'am? I'm sorry, ma'am. We have some technical issues, ma'am. Shall we move on to the session, ma'am?
Yes, well, sure.
Thank you so much, ma'am. Will you be sharing a PPT with us, ma'am?
Yeah.
Could you please try screen sharing, ma'am?
Yes, I have started. Yeah.
It is visible, ma'am.
Yes. Oh, thank you.
Could you please make it in slideshow? Oh, okay, ma'am. Thank you, ma'am.
Is it visible?
Yes, ma'am. It is visible
Or
now, ma'am.
am I audible?
Yes, ma'am.
Yes. Thanks a lot. I'm very grateful for Dr. Sudhir Rajah Memorial Webinar Series conducted by Ayurvedic College, Coimbatore, DIKSHA Academy. In today's lecture, we are going to discuss about Ayurveda Artavakshaya and its Ayurvedic management. First of all, we should know what is Rajah, Artav, and Bahir Pushpa. Am I right, participants?
Yes, ma'am.
Yeah, thank you. What is meant by Rajah? Anyone else? Prasad eva sriya raktaha Rajah Saudhya pravartate tadvarshat vadashat urtva yati panchashatam kshaya. This definition is given in Sutrastan 14/16. Now, what is meant by Artav? Ruto bhavam artavam srinam yad apatyamargat shuddam ishat krishnam viganam cha vayu preritam slohitam pravartate tadartavam uchate. Now, synonyms for the Artav. In Vaidyak Shabda Sindhu, page number 189, it has been told that Artav, Sri Raja, Pushpa, these are the synonyms for Artav. Raja is also called as Pushpa, Artav, then Rutu, Kusumam, etc. These are paryay for the Artav. Prathama Rajo Darshana. Should I know what is the age given by Acharyas, various Acharyas? Anyone else from participants?
Acharya Shushrut.
Yeah. In Shushrut Sanghita, Acharya Shushrut, he has given as 12th year. Is it right?
Yeah.
Yeah. Ashtang Hridayakar, Ashtang Saraya, they are also told as 20th. Okay. Maharshi Kashyap, what he has told? At the 16th age, but it can be influenced by specific ahara and arun. This is the definition which can be applied in the modern area also. Isn't? Rajanuritikal. According to Shushruta, Ashtang Sangrahakar, Ashtang Hridayakar, Bhavatakar, they have told that at the age of 50, this is Rajanuritikal. And according to Arundatta Tikakar, there may be slight variation. Okay, according to Aharvyad again. Prakrut Pramana of Artav. We should know what is the Prakrut Pramana of Artav as we are going to discuss about Artav. So, according to Vagbhat and Bhav Prakashkar, it has been 4 Anjali. Okay, and in Charak, Maharshi Charak has told it is that the exact quantity of Shuddha Artav cannot be described as it may be variable due to Desha, Kala, Ahara, Vihara, and Prakriti. Okay, then duration of Rajakal. According to Charak and Madhav, 5 nights. According to Vagbhat, Maharshi Dvaya, and Bhava Prakash, these are they had told that 3 days, and Maharshi Haritanbal 7 days. Is it right? Is it right?
Yes, ma'am.
Yes, ma'am.
Okay. What is the importance of Raja? Why should we learn about Raja, Artha? Why should? Artava Srotasa facilitates the fertilization and provides nourishment to the embryo and fetus from fertilization to delivery. Modern science also takes consideration of various states of menstrual cycle, menstrual flow, proliferatory and secretory phase, body temperature, etc., while insertion of fertilized ovum in IVF. What is meant by IVF? In vitro fertilization. Okay. Then with the prior knowledge of this rajah, we should go now for the Ayurvedic review of Alpa Pushpa, Artavakshaya or Rajah. Today's topic is Artavakshaya and its Ayurvedic management. So we now go for Alpa Pushpa or Artavakshaya or Rajakshaya. Okay, these are the synonyms for Artavakshaya. Okay, Artavakshaya is the most common disease in women. It has been stated as the forerunner of Nashtartha. It is one of the Arthadosh. No sculptural evidence is available in pre-Vedic and Vedic periods, especially as Artavakshaya. One reference about remedies for Ashabharaja Darshana Shanti finds in Rigved and Atharvaved. Sri Keshav Datta Shastri, the author of Ayurvedic Karmaj Vyadhi Nirodha, has mentioned the pathogenesis of Anartha and its management. In Vandha Kalpadruma, the author has mentioned Nyunartha and its management, but he has not used the word Artavakshaya or Rajakshaya. In Sushruta Samhita, Sutrasthana Uttar Tantra, Nashtartha has been told as one of the cause of Vandhyatva. The word Nashtartha means cessation of menstruation slowly or abruptly, and this cessation of menstrual flow is the Artava dosh. Am I right?
Yes, ma'am.
Yeah. According to Sushruta Samhita, the following Artha doshas has been told: Vataja, Pittaja, Kafaja, Shonitaja, Vata Kafaja, Vata Pittaja, Pitta Kafaja, and Tridoshas. Okay. Artha doshas can be classified according to dosha, varna, and vedana. Maharshi Shrita has told Kudapagandhi, Grantibhuta, Putigandhi, Puyagandhi, Kshina Artava, then Mutragandhi, Purishagandhi Artavara, Asadhyat, and other, that is Ekadoshas, remaining 4 are Sadhya. Maharshi Shrita has told Kshinartava is the synonym of Rajakshaya in Sushruta Sharit 2/4. Maharshi Shrita has described Kshina Artava dosh along with Lakshana and Chikitsa in Sushrut Sharit 2/24. In Sushrut Sutrasthan Dhatu Upadhatu Kshaya Vruddhi, Sushrut Sutrasthan 15th chapter, he has mentioned Artavakshaya and along with its Lakshana and Chikitsa. He has told that Lakshana of Kshina Artav should be considered similar to Artavakshaya, and Chikitsa Sutra for it is as that of Nashtartha or Nashtarakta. Okay. Maharshi Charak, yes? Anything problem?
No, ma'am.
Okay. Maharshi Charak has mentioned Arajaska Yoni Vyapat in Chikisastan 30, Yoni Vyapat Chikisa, and Rajakshinita or Alparka is the symptom of Arajaska Yoni Vyapat also. So here we are going to discuss about Artavakshaya. So also, Arajaska Yoni Vyapat we have to consider here also. Vagbhat first and second has not used the word Rajakshinita, but they have mentioned the Kshinartha or Rajakshinita, both are the synonymous terms. Okay. In Kasham Seta, Maharshi has told Alpa Pushpa word, Maharshi Kashyap has used Alpa Pushpa word to denote Artavakshaya, Rajakshaya, and he has explained in Siddhistan Panchakarma Siddhi Adhyaya that Alpa Pushpa can be treated with Anuvasana Pasati. Maharshi Sharandhar has used Kshinartha word. Bhav Prakashkar, Yoga Ratnakar has used Alpa Pushpa. Then Bhela Samhita, he has told as Alpartava. In Madhav Nidan, there is description of Lohit Kshaya, Yoni Vyapat, along with Lakshanas of decreased amount of Artava. In Haris Samhita, author has mentioned Rajarod. All these references denote towards the Artavakshaya. Now, Nirukti. In Vishal Shabdakosh Sagar, the word Kshaya means Nyunatva Apachaya. In Charak Samhita, the word Kshaya means Rahasa Nyunatva. In Shabda Kalpadruma, the meaning of word Alpa has been written as Kshudra Pramana. According to Acharya Beni Madhav Shastri in Ayurvedic Mahashabdakosha, description of Artavakshaya is as follows. Kshina Artavanama Artavasya Swapramana Hani. Now we go for Nidana Panchak of Alpartava or Artavakshaya or Rajakshaya. Should we go?
Yes, ma'am.
Yeah. What is meant by Nija Hetu? The causative factors which produce the disease process after dosha and dushti are known as the Nija Karanas. By taking Mityahar and Vihar, the respective doshas get vitiated, and while circulating in the body, they vitiate the parts of body and which shows low resistance or immunity. This Nidana Sevan causes Kavaigunya, Dhatu Dushti, and Srota Vrata. Acharya Shrishut has told the word doshehi, that is Vata and Kapha doshas, as responsible for Nashtartava. Hetus of Nashtartava are definitely responsible for Alpartava, Artavakshaya, and Rajakshaya. Following are Nija Hetus responsible provoking Kapha dosh during present days. Eating very unactive, heavy, sweet, and cold food made up from maida, milk, cream, chocolates, etc. Gurugunatmak, Kapha Ahar, and sedentary lifestyle, Divaswap, Kapha Prakopar Vihar. These are Kapha Prakopak Hetus. Now, Vata Prakopak Hetus. Katu Rasa predominant Ahar, Lagu Ruksha Shita Guna Prominent, Katu Vipaki, Shita Vidyatmak Ahar, etc. Suppression of natural urges or platters due to busy life schedule. Peko Dharana, Ati Ratri Jagran, Ati Shrama, Ati Chinta produce Vata. The other causes of provocation of Vata are emaciation of the patient by any of the misleading conditions like fever, vomiting, consumption of excessively cold things in abundance, or undergoes emesis and purgation without pre-ovulation. That is Snehana Karma, or tries to omit forcefully without inclination of Snehana for Vamana Karma. Now, simultaneously, Vata and Kapha Prakopak Hetus are here. According to Charak, if one imaginative goes eating very unactive, heavy, sweet, and cold food again, pest, made of pest, sugarcane, milk, and preparation made up of Guru Gunatmak Dravyas, taking in excess immature curds or wine. The excess use of flesh or wetland, aquatic and domestic animals, suppression of natural urges, and the excessive drinking of after a superfeed meal, roots taking of the body, etc., are causes for the distancing function of Samana Vayu and Kledaka Kapha. Here we have to note Samana Vayu and Kledaka Kapha Prakopaka Hetu. Now, again, Rasa Srota Dushti Karanidanas can be considered in this Hetu of Artavakshaya. Guru Abhishan, the fatty and rich diet, and too much mental work, these are Rasa Srota Dushti Nidanas. Rakta Dhatu Kshaya Nidanas. Rakta Dhatu and Artha get produced from Prasadamsha of Rasa Dhatu. Aha deficient with Rakta Dhatu Prasadamsha produces strenuous workload to fulfill demand of body tissue and produces Rakta Dhatu with low quality and quantity. So a deficient diet which cannot produce Rakta Dhatu is also responsible for producing Artha in less quantity and quality. Am I right? Am I right?
Ji, ma'am. Ji, yes, ma'am.
Rakta Dhatu Kshaya, which are Rakta Dhatu, the Hetus which cause Rakta Dhatu Kshaya are also responsible for Artavakshaya, isn't?
Yes, ma'am.
Now we go for Agantuka Hetu. In anyone else who can tell Agantuka Hetu? Yes, students? Anyone else? In this slide, injury to or trauma to Artavasrotas. That is Garbhashaya and Artavahini, like tubectomy, then dilation curettage and cessation. These are Agantuk Hetu, which causes Artavakshaya. In Sahaj Hetu, The causes of Nyuna Artava according to Vandhakalpadruma. Here it is very clear and beautiful description about Sahaja Hetu in Vandhakalpadruma, that is Garbhashay Apurnata, Nyunata, and Garbhanda Apurnata, Nyunata. Here the word Apurnata or Nyunata may be equated with hypoplasia or aplasia of female genital organ, isn't it? Though we are from Ayurveda science, we must know modern aspect of the disease Artavakshaya, which is similar to oligomenorrhea, hypomenorrhea. But according to modern science, one should know knowledge of amenorrhea in detail to differentiate between amenorrhea, oligomenorrhea, and hypomenorrhea. Isn't it? Am I right?
Yes, ma'am.
Yes, ma'am.
Yeah. So let's take information about amenorrhea in short. What is this? What this diagram represents?
Female reproductive system.
Female. Anepic in female reproductive system, here are anepic defects that may present with amenorrhea. This one is Mullerian-Genesis. Have you heard about Mullerian-Genesis?
Yes, ma'am.
Yes. Then intrauterine adhesions, that is Asherman syndrome, cervical stenosis, transverse vaginal septum, and imperforate hormone. May I know about participants from first year, second year, third year, or from which year? Participants?
I request the participants to please respond.
Yeah. May I know about the...
Ma'am, we have doctors, ma'am.
Okay. Again?
I
Students?
don't know about the students, ma'am. I request the participants to please respond.
Anyone students? I think doctors should already know about Asherman syndrome, Mullerian-Genesis, cervical stenosis. But students which who are new in gynec and obs or Sri Tantra, they should know. Am I right? Students, are there available students?
Yes, ma'am.
From which year? PG, UG?
First year PG, ma'am.
Okay. Then you should know Asherman syndrome. When Asherman syndrome get produced?
No, ma'am.
No. Okay. Asherman syndrome.
Please explain, ma'am.
Yeah. Asherman syndrome, it get produced due to excessive curate of endometrium. When it occurs, we are PG students. We are going to do surgeries in Maharashtra. There are surgeries for which can be performed by Ayurvedic Sri Rog Prasidhanya. Okay. Then while we are going to learn about DNC or endometrial biopsy, we do excessive curate while learning. And this causes what? Endometrial excessive curate. And anterior and posterior vaginal wall get adherent to each other, and it causes honeycomb appearance. This one you can see here, but it is not exactly say hexagonal. Okay. And this hexagonal which goes identified when we do HSG, hysterosalpingography, and we got the picture after HSG, that is here a hexagonal something appearance in the intrauterine cavity, and then it is called as Asherman syndrome, which is caused by excessive curate. Okay. Cervical stenosis, it is most of patient congenital. Then transverse vaginal septum, it is also congenital. Imperforate hormone, it is also congenital. Okay. It is diagnostic algorithm to evaluate amenorrhea, Artavakshaya. Why I have written Artavakshaya and amenorrhea simultaneously or synonymous to each other? Why? When we are going to learn about Artavakshaya, there are lakshanas which correlate or similar to amenorrhea. That's why we are going to diagnose, learn about diagnostic algorithm to evaluate amenorrhea. Here are some short forms which are used, short forms and their long forms, which are used in the previous diagrams. ARS, androgen insensitivity syndrome, CAH, congenital adrenal hypoplasia, then CAIS, complete androgen insensitivity syndrome. Okay, here, when patients come to us with having amenorrhea, why I have told taken as amenorrhea? Because in Artavakshaya it has been told one of Yathochitakale Adarshanam. Yathochitakale Adarshanam. Adarshanam means amenorrhea according to modern science. And disappearance or lack of appearance of Artava with expected days or date or within month, then if there is absent or absence of rajah, then it is amenorrhea. And this amenorrhea, when a patient comes with amenorrhea, we have to examine first clinical examination. You should go in clinic whether patient is actually 18 years or below that, or married, unmarried. You have to take information about that. And if we patient is married and going after the 18-year age, then you have to do pelvic examination, where pelvic examination is normal. Then you have to go first beta HCG. Why beta HCG? Because due to pregnancy, first amenorrhea means we have to think about pregnancy. Beta HCG, if there is increased beta HCG, then you have to take how many, you have to consider weeks of pregnancy and according to take care of obstetric care. Okay. If beta HCG are negative, then you have to go for prolactin, TSH and FSH level. Okay. If beta HCG negative and you have done prolactin levels, then if there are increased prolactin level, you have to go TSH and then accordingly dopamine agonist or surgery as a treatment part. If TSH level is increased, thyroid replacement therapy you should give for that patient. If FSH is increased or decreased or normal, here are three options for the values we have. We get after the laboratory investigation. If the FSH level get decrease, then we should evaluate about eating disorder, stress, then exercise. If there is this positive signs or history, then you have to go for as yes and treat according to eating disorder and stress management, etc. If there is no eating disorder, exercise, stress, etc., then you have to go for MRI and accordingly treat as that. If increased FSH level, then gonadal failure, karyotyping, or premature ovarian failure or gonadal dysgenesis is will be present there. If FSH is normal and test normal, then we have to go for testosterone, DHEAS, and 17-OHP evaluation. If there is increase, then we have to do ovarian sonography. Okay. If testosterone is also normal or high in range, then you have to conclude about diagnosis of PCOS. Okay. If there is also normal or high normal level of DHEAS, then also we have to go for diagnosis PCOS. If only DHEAS to the testosterone, DHEAS is increased, then you have to go adrenal MRI, etc. Okay. And 17-OHP if get increased, then you have to go for CAH. What is CAH? What is CAH? Congenital adrenal hyperplasia. Okay. I think, have you understood the diagnostic algorithm according to modern science?
Yes.
It is little difficult, but if we go in clinics and observe plenty of patients, then it is very easy way to diagnose amenorrhea. Okay. Now, for students which are newly for gynec and obs or general practitioners, we should know new onset of headache or visual changes may suggest a tumor of central nervous system or pituitary gland, and pituitary tumors may impinge or on the optic chiasma, resulting in bitemporal hemiangiosma. That is the loss of both right and left outer visual fields. Okay. Have you got my point? This one?
Yes, ma'am.
Yeah.
Yes, ma'am.
Bilateral breast discharge is consistent with the diagnosis of hyperprolactinemia. The presence of thyroid disease may be associated with heat or cold intolerance, weight changes, and sleep abnormalities. Then hot flashes and vaginal dryness suggest hypergonadotropic hypogonadism, that is premature ovarian failure. Okay. Hirsutism and acne are frequently seen with PCOS and with adult onset of CAH. Cyclic pain would suggest reproductive tract outlet obstruction. Cyclic pain that suggests as reproductive outlet obstruction. Important questions regarding family history include premature cessation of menses or history of autoimmune disease, including thyroid disease, which should suggest an increased risk of premature ovarian failure. A history of irregular menses, infertility, or signs of excessive androgen production may be noted in those with PCOS. Sudden neonatal death may have occurred in family members carrying mutation in the CYP21 gene responsible for CAH, congenital adrenal hyperplasia. Okay. The social history should investigate exposure to environmental toxins, including cigarettes, etc. Many medications should be noted, especially those that increase prolactin, such as antipsychotics. Is it clear?
Yes, ma'am.
Yes, ma'am.
Okay. Now we go for physical examination. General appearance can be helpful in the evaluation of amenorrhea. A low BMI, perhaps in conjunction with tooth enamel erosion from recurrent vomiting, is highly suggestive of an eating disorder. Okay. We in Ayurveda we should smell about the amagandhi. Okay, amagandhi. There is also though a low BMI, perhaps in conjunction with tooth enamel erosion. Amagandhi. We smell ama when patient is. We are going to check patient clinically. We do nakha ashtavidya pariksha, and then we should do gandha pariksha. Then here we got the smell at amagandhi. When there is tooth enamel erosion, it mostly happens amagandhi. Okay. Sign of Turner syndrome should be evaluated, including the presence of short stature and other stigma such as webbed neck or shield-shaped chest. Then midline facial defects such as cleft palate are consistent with developmental defect of hypothalamus, anterior pituitary gland. Okay, hypertension in a prepubertal girl would be consistent with mutation in the CYP17 gene and strengthen the steroidogenic pathway towards the aldosterone. Okay, these are rare cases, but present when we go for endocrinology, then in the OPD of endocrinologist, we meet these cases. Okay, but we have to diagnose these cases in our OPD, not in the endocrinologist OPD. Okay, we have to diagnose. Visual field defects, particularly bitemporal hemiangiospermia, then may indicate a pituitary gland or central nervous system tumor. Okay, skin should be inspected for acanthosis nigrans, hirsutism, or acne, which may indicate PCOS and other causes of hyperinsulinemia or hyperandrogenism. The presence of supraclavicular fat and abdominal striae with hypertension may be noted in those with Cushing syndrome. Okay, hypothyroidism may present with an abnormally enlarged thyroid gland, delayed reflexes, and bradycardia. During breast examination, bilateral galactorrhea implies the presence of hyperprolactinemia. Am I right? Now we have to inquire about genitalia. Examination of the genitalia should start by noting the hair pattern. Lack of adrenalgia or androgenesis syndrome. Okay. Where it is should be present, a sparse or absent female hair pattern may be due to either lack of adrenalgia or androgenesis syndrome. Okay. Elevated androgen levels will result in a male pattern of genital hair growth, in contrast to triangular pattern of hair in female. Okay, these are clinical examination. While we note all these and diagnose which type of pattern, genital hair pattern, and then you diagnose about the chromosomal abnormality. Okay. Laboratory and radiological testing. The differential diagnosis of amenorrhea is extensive, but evaluation of most women is relatively straightforward. For all disorders, testing may be modified by the history and physical evidence. Each and every patient should be advised laboratory tests or radiological tests according to her history. Okay, exclusion of pregnancy is most important in the diagnosis of rajah, Artavakshaya. Okay, progesterone withdrawal. How we can diagnose all these types of amenorrhea, or which will be a factor which is responsible for amenorrhea, that we have to do progesterone withdrawal test. Okay, classically patients are given exogenous progesterone and monitor for a progesterone withdrawal bleeding, which follows a few days after completion of progesterone. Okay, if bleeding ensures, then the woman is assumed to produce estrogen and to have developed endometrium and patent outflow. If we have given some progesterone tablets to patient having amenorrhea, and if there occurs bleeding, menstrual flow, then you have to you don't worry about the development of endometrium. Okay, there must be some I think rajah according to Ayurveda, or low hormonal deficient hormones in that patient. Okay, but there must be, we have to don't worry about the patent outflow tract. Okay, if bleeding does not follow, then patient is given estrogen followed by progesterone. Okay, if woman again fails to bleed, then an anatomic abnormality is diagnosed. Am I right, students?
Yes, ma'am.
Yes, ma'am.
Yes. Yeah. Okay. Estrogen level may fluctuate both in hypothalamic amenorrhea and in some stages of ovarian failure. Okay. In that cases, especially menses may be observed after progesterone administered in up to 40% of women with hypothalamic amenorrhea due to stress, weight loss, and exercise, and in up to 50% of women with ovarian failure. If we go, I have given progesterone, but there is a fluctuation in estrogen, then also menstrual bleeding occurs in 40% cases of hypothalamic amenorrhea and 50% cases of ovarian failure. Okay, so again we have to go for high androgen level. In such cases, such occurs with PCOS and CAH, may have an atropic endometria and failed to bleed. Most of cases came to our OPD with thin endometrium. You have to think about PCOS, CH. Okay, up to 20% of women in whom estrogen is present will fail to bleed following progesterone withdrawal. Now we go for serum hormone levels. As suggested by the practice committee of American Society for Reproductive Medicine, it may be more reasonable to begin with hormonal liberation in any woman found to have a normal pelvic examination. Okay. So Ayurvedic Sri Rog Prasadana should also follow these guidelines, as we have to compete with in modern era with modern gynecologist. Okay. A normal FSH level suggests an anatomic defect or eugonadism, hypogonadism such as PCOS. Okay. In contrast, a low level suggests hypothalamic pituitary dysfunction, and elevated FSH is consistent with ovarian failure. Normal FSH in anatomic defect, eugonative hypogonadism, and PCOS. Okay. Low level suggests hypothalamic pituitary dysfunction. Then elevated FSH level is consistent with ovarian failure. High FSH, ovarian failure. You have to note down that. Okay. Patient with PCOS, hyperprolactinemia, and thyroid disease would be expected to have normal FSH level. Although many patients with PCOS have elevated LH to FSH ratio more than 2. Okay. Testing for this relation is unnecessary, as a normal ratio does not exclude this diagnosis. Students must know, as this is most important thing. We go for, while we are taking subject for dissertation, we do take criteria, LHFS ratio. But we should have to mention in that LHFS ratio more than 2. It is important for the diagnosis of PCOS. But we should know also the relation is unnecessary, as normal ratio also does not exclude the diagnosis. Okay. If an FSH value is low, it may be helpful to repeat the measurement with the addition of LH level to confirm hypogonadotrophic hypogonadism. Okay. An elevated FSH level strongly suggests the presence of hypergonadotrophic hypogonadism, premature ovarian failure. This diagnosis requires 2 FSH levels more than 50 micro international units per milliliter. Okay, obtain at least a month apart. AMH levels are directly proportional to the number of early developing follicles and provide a useful measure of follicle number. You should know all these hormonal levels and their importance while diagnosing of amenorrhea, Artavakshaya, or rejection. Okay. Prolactin and thyroid stimulating hormones. These hormones level should be tested in most patients with amenorrhea, as prolactin secreting adenomas and thyroid disease are relatively common and require specific treatment. Furthermore, hypothyroidism may secondarily lead to elevated prolactin levels. Because of this close relation between thyroid and thyroid disease and prolactin levels, both hormones should be measured simultaneously. Treatment for hypothyroidism will also normalize prolactin levels. If TSH is elevated, an unbound thyroxine T4 level is drawn to confirm clinical hypothyroidism. All Sri Rog Prasadana should know all these, should know about the knowledge of these hormone levels and their importance while diagnosing of amenorrhea. Otherwise, medical legal cases are will be present there for Ayurvedic Sri Rog Prasadana. As we go for treatment part of Artavakshaya, that there are many various kalpas or single dravyas which we should be used in Artavakshaya. But if there is something happens wrong about treatment, while treating this Artavakshaya or Rajakshaya, patient have right to make noise, voice against the treatment. Okay, in Maharashtra, these cases are seen. Okay, testosterone. Serum levels of this hormone should be measured in any woman with suspected PCOS or with clinical signs of androgenesis. Hormonal elevation evaluation should include measurement of serum total testosterone level. Mild elevation in testosterone level are consistent with diagnosis of PCOS. However, values exceeding 200 ng per DL may suggest the presence of ovarian tumor and should be evaluated with pelvic sonography. Dihydroepiandrosterone sulfate. Okay, secretion of this hormone is essentially limited to the adrenal gland. High normal levels or even very mild elevation are consistent with PCOS. Adrenal adenomas may produce circulating DHEAS levels more than or above 700 mg per DL and warrant investigation with MRI, okay, or CT scan. Measurement of 17-hydroxyprogesterone aim to identify the patients with adult onset of CAH. Okay. Now, radiological evaluation. Any patient with hypogonadotrophic hypogonadism should be assumed to have an anatomic abnormality until proven otherwise by imaging of brain and pituitary gland with MRI or CT scan. Patient with Kalaman syndrome frequently demonstrate defect in the development of olfactory bulb and sulci of the mesencephalon. Okay. Chromosomal analysis. Patient with gonadal dysgenesis such as Turner syndrome should be considered for karyotype. For diagnosis of premature ovarian failure, the etiology is not clear according to modern science also. So we have to test or knowledge of this laboratory testing. That's free T4, TSH, thyroid, then calcium, phosphorus, albumin in parathyroid, then ACTH in adrenal, fasting glucose, HbA1c, islet cells, then CBC, red blood cell, hemolytic anemia, pernicious anemia, and platelet, idiopathic thrombocytopenia. These are the target organs which produce pathology and causes in turn preterm premature ovarian failure. So we have to need about knowledge of these tests. Okay. Now we go for Artavakshaya. Okay. Should we go?
Yes, ma'am.
Yes, ma'am.
Okay. Have you got my points about hormones?
Yes, ma'am.
Then diagnosis of amenorrhea. How to diagnose amenorrhea? Am I right? Algorithm?
Yes, ma'am.
Okay. Then now we go for Purva Rupa and Rupa. Okay. No premonitory symptoms of Artavakshaya or Alpartha have been mentioned in Ayurvedic tests. Okay. Lakshanas we get observed are as follows. Yathochita kala or darshanam or darshanam of rajah or artam. Alpata of rajah or artam, yoni vedna and bandhyatva in some patient. Okay. Yeah, what is meant by yathochita kala or darshanam? In the reference given in Shishra Samhita, the word yathochita kala or darshanam means the menses do not appear at the appropriate time. Here the word appropriate time means the time when a girl attains the maturity. The time is named as yathochita kala. If a female is of, yes, anything else? Yes, anything? Yes. Something disturbances in the, okay. This time is named as yathochita kala. That is, if a female is of 18 years, menses have not started, though it should be started, have to start at the age of approximately 12 years in India. The other meaning of Yathochita Kala is that in a female who was menstruating regularly previously and now the intermenstrual periods are of long duration as compared to her previous intermenstrual period. The menstrual flow duration has lessened as compared to her previous menstrual flow. Okay, and where there will be Yathochita Kala Darshanam means at the age of menarche, there should not be their menses has not been started. Then Yathochita Kala Darshanam means the intermenstrual period are little bit prolonged, and in the duration of menstruation has been lessened. Okay. Alpata. What is meant by alpata? This is the second cardinal symptom of Artavakshaya. The word alpa means Kshudra Pramana, according to Shabda Kalpadruma. And Acharya Charak has described about the Lakshanas of Shuddhartha, and he has not mentioned the exact quantity. He has used the word neither too much excessive nor too much scanty. So we have to go for history or menstrual history of that patient. How when there's after how in intermenstrual period and flow of duration of flow, okay, quantity of flow, okay. Due to variation in a Desha Kala, Ahara, Vihara, Vikruti, Jati and racial factors, its quantity may also vary. Acharya Bhav Prakash and Bhagavad have mentioned quantity of Shuddhartha as a 4 Anjali. In modern medical science also, there is no definite criteria for quantity of normal menstrual discharge as already have been described previously. In various books, from Datta, it is 25 to 50 ml, 80 ml. Then 5 teachers, again there is variation. In some books, it is written as 100 ml. Okay, so in a modern science also there is not exact criteria or exact quantity of normal menstrual flow. Okay. Second meaning we have to consider from Alpada is lessening of the duration of monthly period, which remains for 3 days, at least 3 days. Okay. According to Acharya Charak, it is now 5 nights. According to Bhagavad, 3 days. Maharshi Hari mentioned as 7 days. According to Halliburton Physiology, 3 to 5 days. And according to 10 teacher midwifery, it is 4 to 5 days. That is it. From this, we should know that there is not exact duration of the menstrual flow, days of menstrual flow. Okay. Yoni Vedna. In Artavakshaya, visualization of Apanavayu causes Yoni Vedna. Maharshi Shushrut has described vegetative vata and kapha doshas are etiologic factor. In visualization of vata causes Kshinatmak Samprapti. Visheshan of Apana and Kapha togetherly produces Avrudatmak Samprapti. And Kshinatmak or Avrudatmak Samprapti causes reduced quantity of Artha Utpatti, which further causes inadequate Abhipurana of a Garbhashaya. This inadequate Abhipurana of a response is responsible for further Vata Prakop, which produces Yoni Vedna. Here, vitiated Vata dosha causes Toda Bheda. Vitiated Kapha dosha causes Yoni Kandu, and vitiated Yoni Kandu produces intense sensation of scratching, which in turn causes Osha Chosha and Daha. Okay. May I get how Yoni Vedna get produced in Artavakshaya? The answer of how Yoni Vedna get produced in Artavakshaya? From the participant, please. Is anyone else?
I request the participants to please answer the question.
May I get the answer of how Yoni Vedna get produced in Artavakshaya?
Due to cervical stenosis.
No, I have explained in this Please.
Due to Vat Prakopa.
According to Ayurveda.
Vat
Vata
Prakopa.
Prakop. Why Vata Prakop occurs? Why Vata Prakop occurs? Because inadequate abhipurana of Garbhashaya. Okay. In Vandhya Kalpadrum, the following signs and symptoms of Artavakshaya have been illustrated: burning sensation during the coitus, kampa, brahma, and nausea. Then again headache, nabhishura, unconsciousness, gargling sound in the intestine, and itching all over the body, bad smell of the body, then coating of the tongue, and mandakti. Lakshanas of Artavakshaya should be considered here as a Bandhatva, Maithun, Asahishnata, and Artavanash also. Okay. Lakshanas of Prasava Srota Drishti should be considered in Artavakshaya. Here, Aruchi, Virasta, Alasya, Tandra, Angamarda, Panduroga, Shaithilya, Mandagni, etc. Wrinkles on the body, premature graying of the hair. These are also, these lakshanas should be noted while diagnosing of Artavakshaya. Symptoms due to vitiated Vata dosha, Admanaka, then Krushata, Karshna, longings to hot articles, Kampa, Shirashula, Sandhishula. Okay. Then Balahani, Brahma, Pralapa, Indriya, Daurbalya, etc. Then vitiated Kapha dosha, symptoms due to vitiated Kapha dosha, Aruchi, Lalasra, Didra, Adikta, Alasya, Shita, Sparshata, Agni Shaithilya, Swasa, Stola. These lakshanas should be considered while diagnosing of Artavakshaya. So one has to take dosha sammurchana, which those should be more as compared to other. Vata or Kapha. Vata is Prabala, or Kapha dosha is a Prabala. Okay. Symptoms due to Pittakshaya. These are also we have to consider Agnimandya, Prabhani, Angashitata. Manasik lakshanas, lack of concentration due to Vata Vriddhi, Chinta, due to Vata and Glani. These all we get observed in hypothalamic disorders. Okay. Samprapti. In Sushruta Samhita, this Samprapti has given for Nashtartava, which can be applicable for Artavakshaya. Doshe avruttamargutvat artam nashyati sriha doshe ityadi atra doshaha kapavayu vatakafo cha na tu pittam pitto ruddho tasyati ruddho buddhavata kulattadi vatakapahara dravyat achanatva nashyanti iti pravartamanam na drishyate na tu sarvata kshayamyanti. Here, yes, Dalhan has explained that which doshas, kapha and vayu. Okay, why? Because if pitta is pitta get prakopit, then there will be ati vriddhi of rajah. Okay, but here in rajakshaya or artavakshaya there is a decrease amount. Okay, so there must be vata and kapha. And the drugs which are advised to use are pitta vriddhikara, so which are helpful to decrease in vata and kapha. Okay. Samprapti, the indictive pathogenesis of Nashtartha, dosha word has been used for combination of dosha. The word avrutta means to get obstructed due to the obstruction in Artavakshaya. Yes. Due to obstruction in the Artavakshaya, the quantity of Artha ceases or it stops totally. There is no discussion about the name of dominant doshas, about the dravyas mentioned, but the dravyas mentioned in treatment of Alpartha are Vata and Kapha Shamak. Therefore, dominance of dosha, that is Vata and Kapha, has been presumed as a etiological factor. Okay. These are the causative factors which play important role in the samprapti, dosh, Vata and Kapha, and Pitta, Kshina Pitta, Dusha, Rasa, Rakta, Mansa, Meda, Ajja, Upadhatu, Artava. Okay. Srotas, Andavah, Purushavah, Rasavah, Raktavah, Mamsa, Meda, Majja and Artava Slotas. Adhishtan, Garbhashaya and Artava Slotas. Marga, Madhyama, Marga. Jatragni, Agni, which plays important role, that is Jatragni, Rasadatva-Agni, Artava-Agni, and Rakta-Agni. It is the diagnostic presentation. Should I go? Yes?
Yes, ma'am.
Okay. This Pradhana Dosha to 7, it causes Agnimanda. Agnimanda causes Dushti, Jatragnimanda, and Dhatvagnimanda. Dosha Dushti, Vata Prakopa, Kapha Prakopa, Pitta Kshaya. Vata Prakopa causes Samana, Vyana, and Apana Vayu Dushti. Here, this Vayu causes Sankocha, and Dosha Dushti, that is Kapha Prakopa Dushti, causes Kapha Dushti, which causes Upalaipa. Pitta Kshaya Dushti causes Pachaka Pitta Dushti. Togetherly, all produces Upalaipa and Sankocha and then Artavakshaya. Here, Jatragni causes Amatpatti, which causes Srota Dushti, that is Rasa, Rakta, Mausa, Medoha, Srota Dushti. Dhatvagnimanda, again it causes Dhatu Dushti, that is Amarasa, get produced, then Amarakta, Amamausa, Amameda, and Amadhatu. Okay, all these causes Artavakshaya. Okay, Vyavachiddak Nidan of Artavakshaya. Vatala of Shandi, Vandya, Shushka Revati, and Kadambara and Vikuta. In Vatala Uniped, Charak has given the cardinal features of Vatla Uniped, that is a Piplika, Sarpanavata Vedna, Stambha, Rukshata, and Laguta in Yoni. According to Charak, the cardinal features of Univapad is Karsha and Vaivarnya. Okay. Shandi Univapad, according to Shandi, the clinical features of Shandi Univapad are Anartava, Astani, and Kharasparsharidum coitus. In Vandha, the cardinal features are Nashtartava, while in Alpartava, the cardinal features are Yathujitakale, Adarshanam, Alpata, and Yonivedna. Okay. Shushka Revati, when a female attains her age at 16 years old, even her menstrual phenomena does not get started, and her bahu, Rakucha, Spika Pradesh get emaciated, and then she is considered to be suffering from Shushka Revati Graha. Okay, according to now present as this Graha, Shushka Revati Graha, there we should consider for the metabolic disorder. Okay. Katambara, the woman who does not menstruate in Uchita Kala and becomes Krusha, Hinabala, Kruddha, and ultimately dies, is known as Katambara. These are again similar to that of CH, adult onset of CAH. Okay. Vikuta, when the menstrual discharge is Vishama in Kala, Varna, and Pramana from the very beginning, and there is Palhani, Klani, and then the woman can be considered as suffering from Vikuta Jataharani. Okay. Artavakshaya has Lakshana of Sarvadhik. In Pandu, Medurdi, Rajakshaya, Rajakshma, then Apatarpanjanya Vyadhi, and Dhatvagnimandya. Here, Artavakshaya Lakshana get produced, and this is a differential, this can be used for the differential diagnosis. Okay. Sadhya Sadatva, according to Vagbhata, Acharya, Vagbhata, it is Sadhya, and according to Maharshi, according to Shushruta, it is Asadhya. Chikissa Siddhanta of Alpartava. First one we have to avoid. Hetu 7, that is a Nidana Parivarjana and Vatashama. Maharshi Shushruta has told Swayoni Dravyas, that is Saushadan Dravyas, use of Swayoni Dravyas, Saushadan therapy, Agni Dravya, use of Agni Dravyas, and Shukra Doshahara Aushadha. Then Maharshi Shushruta has also advised the treatment which is similar or used for Nashtartava. Ashtanga Sangrahakar, Pitta Ruddhikar Ahar Vihar should be advised for this patient. Then Bhav Prakashkar, he has also again told us use of Swayoni Dravyaj. Katvamre Lavanoshani Vidahini Guruni Palashakani Panani iti Sri Akamshate Artavakshaya. Jojo, patient which disease she should be given, which will be which might be of Katu, Amla, Lavana, and Ushna dravyas. Okay. Treatment of Artavakshaya or Alpartava. Oral treatment, Acharya, he has told blood of deer, goat, sheep, hog, which is not possible, but we have to go for curd, mixed juice of acidic fruit, then life promoter drugs, Jivani dravyas. Then again, Acharya Vagbhati has told Raktakshaya Kshiram Jivaniyam Shrutam Pipet. Jivaniya Siddha, Jivaniya Dravya Siddha Gruta you can use. Then for Yogaratnakar, he has told that Tila Shailu Karibinam Patham Pitwa Cha Gataraja Mahila Sagudam Shishiram Dina Janayati Kusamna Sandeya. He has told that Krishna Tila Shailu Karibi and Buddha. Then a decoction of powdered leaves of Jyotishmati, Swarjika, Kshara, and Rajika or Ugra, and the stem of bark of asana with cold water. Okay. These are some kalpas. Sita Kalyanaka, Raja Pravatni, Phala Kalyanaka, Kumar Kalyanaka, Kalyanaka Gruta, Maha, etc. Okay. Lashuna Tel and Lashuna Gruta. These are very helpful in treating Artavakshaya. Shatapushpa, Shatapushpa Kalpa. It is also very useful in Artavakshaya. Stanik Chikisa Dantyadivarti. Then Uttar Basti with Kashmiri and Kuteja, according to Charak. Astapana Basti should be used. Anuvasana Basti also you can use in Chikisastan, Kashyap Sahita Chikisastan, he has advanced Anuvasana Basti. Patyapatya, Fisha, Kulatta, Kanji, etc. you can use. Then Apatya, which aggravates the aggravates Nidanas and contraindicated, that is Divaswapa and Ratri Jagarana. These are the research work which in Maharashtra and other university all over India has been done. These first three are done at our research institute. Okay. Exploratory study of Kulatta Siddha Matra Basti in Artavakshaya, clinical study of Hingvadi Tel Matra Basti in Akshida Artav, and study of the efficacy of Lasun Tel and Vasan Basti in Alpa Pushpa Artavakshaya, Evam Artavakshaya. These are three which are done at our institute, and there are all from our all over India. Okay. Artavakshaya Adhyayana, comparative study of etc. Okay. These are some research work which are done in India. Okay. If I go for question and answer session or any doubt clearance session?
Yes, ma'am. We have a doubt clearance session, ma'am.
Yeah.
Thank you, ma'am, for taking your time to prepare for such an extraordinary, enlightening session, which was incredibly informative. We will go ahead to the question and answer session, ma'am. Shall we begin, ma'am? Ma'am, the first question is that, ma'am, can we treat Sahaja Hedu hypoplasia or uterus having infertility?
No, we cannot do treatment for hypoplasia.
Thank you, ma'am. Shall I move on to the next question?
Yeah, you have to, yeah.
Oh, sorry, ma'am. Please continue, ma'am.
We have to diagnose first hypoplasia. Hypoplasia, there are stages of hypoplastic uterus. So, in which category the uterus is hypoplastic? So, just sonographical diagnosis is not very important. So, we have to first diagnose real or diagnostic real cases of hypoplasia cannot be treated with Ayurvedic or infertility treatment. Okay, according to my knowledge.
Thank you, ma'am. Shall I move on to the next question, ma'am?
Yeah.
The next question is that, ma'am, what would be the diagnosis and treatment of a patient who came with a USG which shows bilateral ovarian cyst, but all FSH, prolactin, and TSH levels are within the limits. And skinny body type, ma'am, but irregular periods and are having hairs on face, ma'am.
Yes, repeat the question, please.
Okay, ma'am. Ma'am, what would be the diagnosis and treatment of a patient who came with a USG which shows bilateral ovarian cyst, but all FSH, prolactin, and TSH levels are within the limits, ma'am?
Okay.
And the patient has a skinny body type, ma'am, but she has irregular periods and are having hairs on face, ma'am.
Okay. We have to do a cyst get formed due to drava. Okay. There is obstetric Vatakafaja dosh dushti, but there is more pathology regarding pitta dosh. Dravatva is there though, so due to drava kuda of pitta, the cyst get formed. And due to Vatakafa, this is the cystic the liquor or the liquid in the cyst does not get out of that cyst. So we have to do Artava Vruddhikara Chikitsa. That is a Pitta Vruddhikara Chikitsa. You have to go. Agni Vardhana Chikitsa. You have to do that. And Vata Shamana. Okay?
Okay, ma'am. Thank you, ma'am. Ma'am, the next question is that, ma'am, what is the Ayurvedic medicine which can be given for hyperprolactinemia, ma'am?
Endometrial hyperplasia.
Hyperprolactinemia, ma'am.
We have to do.
Hyperprolactinemia.
Yeah.
Okay.
We should know the exact cause of hyperprolactinemia. If it is from CNS, then you have to do go for modern medicine. For Ayurvedic, we do Pasti Chikitsa. Okay, Vata, which get produced and produce Margarojanya or what Udavarta like Samprapti, then and then only we have to go for Vata Shamana Chikitsa. Basti Chikitsa, Dashmul, it is very helpful in that cases. And Trunamula Kshaya, use of Trunamula Kshaya, it is also helpful.
Thank you, ma'am. Ma'am, the next question is that, ma'am, if TSH is raised, then free T4 will be always raised. Is that true, ma'am?
Yeah.
Ma'am, kindly explain the situation, ma'am.
For a diagnosis of raised TSH, isn't? Am I right?
Yes, ma'am. Yes, ma'am.
There may be, you have to go, you don't have to go for TSS each time. You have to go just for T4. Okay.
Okay.
So patient will be beneficial for economic purpose, and we have exact picture of T4, and then we have to clear-cut idea about T4 and diagnosis. Okay.
Okay, ma'am. Thank you, ma'am. Ma'am, a patient is having AMH levels low, ma'am. What will be the treatment, ma'am?
Patient having
AMH levels which are low, ma'am.
Okay. Actually, we have given Lasuna Tela Matra Basti and Lasuna Tela Anvasan Basti. Then Lasunati Bati, Hingvashtak Chuna, Hingvadi Gruta. These are helpful in AMH. We have observed these cases in Maharashtra.
Thank you, ma'am. Ma'am, we have a participant who has raised her hand, ma'am.
Okay.
Ma'am, we can ask you a question, ma'am. Mamta, ma'am.
Yes.
Ma'am, she has raised her hand, but she's not.
Yes, I'm not visualizing. Yeah. Is hematosalpinx cured in Ayurveda? what can be given in endometriosis causing hematosalpinx? You have to take consideration what is the cause of hematosalpinx. If it is endometriosis, then you have to treat Udaharta like that of Udaharta Univapat. Okay, you have to go Niruha and Anvasan Basti Vyatyasat, and you have to do Bhatashamana Chikitsa. Tiryaka Pitta. You have to do treatment for Pittaka, Tiryaka Pitta. Okay. Upadhato Prasa is Stanya and Artava. Please tell me, ma'am, is this only for female? Yes. For female, this means there is no Upadhatu in a male. No. If this is also for male, then there is no Stanya and Artha found in male. Please clarify this. Upadhatu of rasa is Stanya and Artha. Yes. Then please tell me, ma'am, this is only for female. I think you have to go for dhatu upadhatu in a sukshma rupa. Okay, upadhatu, which is drushya, or we see as a stanya or artava. These are malina artava. Shuddha artava is in the uterus. Okay, am I right?
Yes, ma'am.
Okay, then when we see rajah, that is a malina artava. Shuddha artava is inside the uterus or artava. What is the exact artava srota sthana? May I know? Arjun Kumar Singh. Yes, please, sir. Artava srotasa. Garbhashaya and Artavainya Dhamanya. This is the Vyaktisthana of Artava. Okay. Artava is get formed or produced in each and every cell, according to me. Each and every cell have Artavagni. Okay. But the Drishamana is our visualization of Artava is in a Artava Srotas. So, according to me, in a male, okay, upadhatu. There is no upadhatu. I think here this means there is no upadhatu of male. I can't say that so that there is no upadhatu in male. We can't see that upadhatu in male. Okay, but the gunadharmas of upadhatu are present in male also. Okay, am I right?
Yes, ma'am.
Yeah.
Thank you, ma'am.
Anyone else? Other questions?
Ma'am, there are some more questions, ma'am. Shall I read them out?
Yes.
Ma'am, is there any Panchakarma treatment in the case of Artavakshaya?
Panchakarma treatment for?
Artavakshaya, ma'am.
Arthakshina. Shina Artava? Yes, we do Panchakarma. Like first one, we have to go for Snehana Sveda. Prakruti Parikshan. First, we have to go for Prakruti Parikshan. According to dosha samurcha, which dosha get produce pathology, samprapti. If there is a kshina, pitta, you have to go for pitta kshina. Then you have to go for vamana chikitsa. Okay. If there is vata and kapha, then we have to dipaniya, dravya use. And basti chikitsa is useful for vata shaman and agnivartan also. According to the basti action. Okay. We use Sasni Haniruha, Gomutra Haritaki, then Lasuna Taila, then Kulatakwatha, then again Hingvaditel, We have mentioned all that, which we use in our institute. Okay.
Thank you, ma'am. Ma'am, we have a question from a participant who's watching this in YouTube live, ma'am.
Yeah.
Shall I ask, ma'am?
Yes.
Ma'am, why is prolactin level high in certain cases of PCOS, ma'am?
Prolactin level. Okay.
Yes, ma'am.
According to me, in PCOS, there is also thyroid hormone abnormality. Okay. If there is a TSH level abnormality, then also prolactin level get produced. Okay. Higher side. Yes. Yes, I will share my PPTs. Yes, I will share my PPTs. Okay.
Ma'am, we have some more questions left, ma'am.
Yeah.
Ma'am, what are the medications that can be used to treat Yatoshitta Kala Darshana or irregular cycles in PCOS, ma'am?
Rajah Pravartini, then Hingu alone, AKD Dravya, single drug. Okay. Then Jivaniya Dravya, if there is a Kshinatva of Artava, then Dashmula. Okay.
Okay. Thank you, ma'am.
Yeah.
Ma'am, the next question is what to do in secondary amenorrhea, ma'am?
Yes, again, repeat.
Ma'am, what to do in secondary amenorrhea, ma'am?
You have to diagnose first. Is it secondary amenorrhea? What is the we have to diagnose whether it is helpful Ayurvedic treatment. You have to take response T and limitations of Ayurvedic treatment and modern treatment, which are complementary to each other. You have to diagnose all that first one, and then you go for treatment part. Okay.
Thank you, ma'am.
Okay.
Ma'am, the next question is that what is the treatment of a neem female of 22 years with menstrual cycle that is regular, but she bleeds for less than 1 to 2 days in less amount, ma'am?
I have used Lasuna Taila, which is prepared according to Kashya Samhita. In that Lasuna Taila, Gruta Taila, Jivaniya, Dashamula, then Agniya Dravyas, Deepaniya Dravyas are all present. There are 37 drugs in Lasun Tail, which is and this Lasun Tail Basti is helpful in Kshina, also in obese PCODs. Okay, I have this is my PhD topic, and I have actually treated this patient. That's why I'm confidently say that Lasun Tail Basti is beneficial to both in obese and lean PCODs. Okay.
Thank you, ma'am. Ma'am, the next question is how can we correlate Artavakshaya and PCOS, ma'am?
In PCOS, there are various three types predominantly. Prolonged intermenstrual period, scanty menses, and there is a profuse bleeding, intermenstrual bleeding. In when we are comparing with Rajah Kshinata or Artavakshaya, there may be scanty menses, which is 3 days or less than that, and intermenstrual period more than 35 days according to modern science. Okay, but in according to Ayurveda science, we have to take proper history. Okay, menstrual history, and according to menstrual history of that female, you have to diagnose rejection whether this Raja is less than the quantity of previous of her own compared to her own. Okay, and then only you go for treatment. If there is Rajakshynata in that patient, according to compared to with her own menstrual history, then you can go for Artavruddhika Dravyas. Simple churnas you can use also. Okay, which are Agnivardhak. Okay. Vatashaman Yogaraja Gupta is also helpful. Dashmuladikvat is also helpful.
Okay, ma'am.
We have used Lasuna Tail Matra Anuvasana Basti from the 4th day. That is cessation of menses. 4th or 5th day of menstrual cycle up to 12th day. Okay. For 3 menstrual cycles.
Thank you, ma'am.
Here, Shamana medicine for scanty menses. You have to go for Lavana Siddha Matra Taila. Lavana Siddha Tailam Matra Basti. Instant pain get subsided. Okay.
Thank you, ma'am.
Okay, thank you.
Ma'am, the next question is that, ma'am, what Ekadravyas can be given in amenorrheic, fatty and lean woman with facial hair and acne, ma'am? Will the chikitsa be same, ma'am?
Ekiti Dravya. Am I right?
Ah, yes, ma'am.
For acne. Ekal Dravya
Yes,
for acne,
yes,
no?
ma'am.
Yes.
Yes, ma'am.
Ras.
And she's having amenorrheic fatty, ma'am.
Okay. Kumari, Yakrut Uttejaka Dravyas. Acne, according to Ayurvedic science, it is a rasa and rakta dushti. Okay. So we have to treat Yakruta. So Yakruta Uttejaka Dravya, we have to use.
Okay, ma'am. Ma'am, we have a hand raise, ma'am.
Yes.
Dr. Sindhuja, can you ask your question, ma'am?
Namaste, ma'am.
Yes.
Ma'am, in case of astrudhara or excessive bleeding,
yeah,
Basti is indicated, but actually in conditions of indications of Basti, it is while bleeding, Basti is contraindicated.
Yeah.
So can we give Basti, ma'am?
According to me, while there is a asruja or ati raktasrava, yonigat raktasa, you should not go for Basti chikitsa, according to me.
Okay. If for some days we have to give medicine and then stop, and
yes,
then for regularization of periods,
I will go for combination of modern and Ayurveda treatment. In Maharashtra, both we can use modern medicine and Ayurveda simultaneously. And if we go for modern medicine to stop the bleeding, and then after cessation of PV bleeding, you go for Ayurveda. Okay.
For stopping, which kind of Ayurveda medicines can be used, ma'am?
Yeah.
For stoppage of bleeding,
we have to go for progesterone tablet Primetrian. Okay, Primetrian, TDS or BD and OD. We have to taper all that. First, we have to go 10 mg TDS, then BD for 7 days and OD for 7 days. Then menses recur, and then we go for Basti Chikitsa and for 4th day of menses. We use this pattern of treatment in our institute. Okay.
Okay. Direct Ayurvedic medicine we can't give, like starting hormonal tablets.
According to me, I can't advise. Okay.
Okay. Thank you.
Thank you, ma'am. We have another hand raised, ma'am.
Yeah.
Dr. Tomar,
Madam?
please go ahead and ask your question, sir.
I have one question regarding the fibroids patients generally complain about the bleeding throughout the month. It is not actually bleeding, but there's some spotting is going in. So yes, please guide us about the treatment line, please. Yeah.
Actually, ma'am, when we are doing research about Artavakshaya, these types of patient we have got, and for this patient we have to do I have used low dose pills, contraceptive pills. We have given for 1 month, then cessation of flow, intermenstrual flows, that is spotting, and then we go then we have given that patient Dashmur and Dashmuradi Kathab and Dashmuradi Taila. बस्ती व्यत्यासात. Yes, ma'am.
Thank you, madam. Thank you, madam. Thank you.
Thank you, ma'am.
Thank you. Thank you.
Ma'am, we have another question.
Yes.
What are the medicines according to you? I'm sorry, ma'am. Medicines used according to thickness of endometrium, if less and if more thickness, ma'am.
For Liz, you give Jivaniya Dravyas, okay? And for thickness, we have to give Kafagna Dravyas, okay? For Kafagna Dravyas, I think you have to give Agniya Dravyas, which can introduce Avrutatva of a Kapha and Vati to each other and treat the patient accordingly, okay?
Thank you, ma'am.
Okay.
I request the participants to post their questions in the chat box, or you can raise your hands to ask questions to ma'am directly.
Yes, anything, anyone? Yes, Dr. Toman.
Yes, namaskar, madam.
Yeah, namaste.
Ma'am, you can go ahead and ask a question, ma'am.
Yeah. Jivaniya Gan is not available in market. So
Yes.
how can we procure it, and where you are getting it from it, or your own plantation is there, or
No, I have actually we have taken these drugs from Himalaya. Okay, I will take give you addresses of that pharmacies and authentic sources. Okay.
Please, madam, it is very
Yes,
much
I will
needed.
share. I will share. Okay.
Thank you. And secondly, madam, where and Kashyapat Lashunade Tailam.
Yes, yes.
Is there any company who is preparing it this for you, or yourself you are preparing?
Yeah, I have prepared myself for my PhD work. Okay.
Okay, so thank you, madam. Thank you.
Thank you.
Ma'am, can you share this Lasunadi oil?
Yeah, yes, I can. I can share my PhD thesis to DIKSHA, okay?
Thank you so much, ma'am. Ma'am, we have another hand raised, ma'am.
Yeah.
Please go ahead and ask your question, ma'am.
Hello, good evening, ma'am.
Good evening.
Ma'am, I have a question. I have a patient of hypothyroidism.
Okay.
With amenorrhea. What can I give to her?
Agnivati Chikitsa. Actually, in hypothyroidism, actually, I have not given all that. But in Kerala, Chikitsa, Agnivardhan Chikitsa, Agniya Dravyatmak Chikitsa is available, which is useful for hypothyroidism. Okay.
Ma'am, I am giving Agnivardhan Chikitsa from 10 to 15 days, but she didn't got her menses.
Nasya Chikitsa, Anutaila Nasya, then Shatapushpa, Siddhataila Nasya Chikitsa is also available, but I have no idea about the exact result of that Nasya Chikitsa. I have heard about that. I also given Nasya, Anutaila Nasya in hypothyroidism patient, and the lakshanas of hypothyroidism get reduced, but in the form of level of that hormone, I can't say. Okay.
Okay, ma'am. Ma'am, I have another question.
Yeah.
Ma'am, I patient of scanty menses. What can I give for shaman medicine, ma'am?
Shaman medicine already. Which dose you have to give shamana?
Ma'am, she have a complaint of 1 or 2 day menses only.
Okay. You have to diagnose first which dosha samushna is there, vata pradhana or kapha pradhana, and do accordingly. If there is pitta kshaya, agni dravya should be used, which are helpful in vata and kapha. Okay, vardhana. Sorry, vata and kapha shamana. Okay, and pitta vardhana.
Okay. Okay, ma'am.
Okay.
Thank you, ma'am.
Yeah.
Ma'am, we have another question in the chat box, ma'am.
Yes.
Ma'am, what is the use of Khanashadavyadi Kodha, ma'am?
What?
Khanashadavyadi Kodha, ma'am.
I can't audible. I'm not audible.
Shall I
The
spell it
question.
out?
Shadangadi.
Sorry, ma'am.
Shadangadi.
No, ma'am. Khanashadavyadi Kodha, ma'am.
No. Can't get your question.
Ma'am, shall I spell it out, ma'am?
Yeah.
Ma'am, she's asking what is the use of Khanashadavyadi Kodha, ma'am? Kanashadavyadi.
Kana means, I think, according to Maharashtra, this patha is not available. But according to my knowledge, Kana, no? Pipali. Am I
Yes,
right?
ma'am.
Yeah. Shatava.
Yes,
Shatavari. Yeah. But you have to use for that. Kana, that is a phala, fruit. Okay. Which is a vrishya. And Pipali Mula is a Artava Garbhashaya Sankochaka. Am I right? And Shatava, that is a estrogen which gives endometrial to increase endometrium thickness. Okay, this can be used. Kana Shatavyadi kshaya, according to me. But this kshaya is not available in Maharashtra. Okay.
Thank you, ma'am. Ma'am, Dr. Pinky has raised her hand again, ma'am.
Yes, ma'am. In which days of the cycle and in which Aushadakala and which Anupana we have to give Shamana medicine for Artavakshaya. Okay, am I right? Hingvadi Bhati, we have started Hingvadi Bhati from the 4th day of cycle up to till start of the next menses. Then again we stopped that medicine Hingvadi Bhati for 4 days, and then again started. This Hingvadi Bhati we have used for 3 months, and there is induction of ovulation, endometrial thickness, and also pregnancy. We have confirmed cases of pregnancy. Okay, use of confirmation. This Hingvadi Bhati is very beneficial in Artavakshaya. Okay.
Thank you, ma'am.
Thanks a
And
lot.
Dr. Pinky has raised her hand, ma'am.
Yeah.
Mute yourself and ask the question, ma'am.
Yes. Ma'am, what is the exact correlation PCOD in a Ayurveda Pushpagni Yoni Vyapada? According to Kashyapa, the exact symptoms are present in Pushpagni Jatni. Yes, you are right. Hingvadi Bhati reference. Sahasra Yoga. Okay, Hingvadi Bhati from Sahasra Yoga.
Thank you, ma'am. Ma'am, we have another hand raised, ma'am.
Yeah.
Good evening, ma'am.
Good evening.
Ma'am, thank you for lecture. My question is that one of my PCOD patient does not getting periods after giving all these medication. There is 3-4 month gap. Sometimes she used to take progesterone for periods. From last 1 year, I am giving Ayurvedic medication, but her periods is not regulating, ma'am. And she is also having bilateral tubal block. And thin patient, Vata Pitta Prakriti. And she also have history of tuberculosis in her childhood.
Okay. Ma'am, according to me, there may be synec due to tuberculosis. So there might be a tubal blockage. Okay.
Yes,
and according to me, pathology of tuberculosis, endometrium get destroyed. That's why there is a amenorrhea or Artavakshaya. Okay. So you have to treat that patient according to modern science. Okay, not Ayurvedic science. You have to limit our Ayurveda and modern science. You have to treat. If she has taken proper antitubercular drugs, okay.
Ma'am,
And
she has completed her course twice.
yeah, but still, according to me, if there is no endometrium, then there will be less chances of treating with Ayurvedic medicine. But I can't say that there is no hope in treating these patients. You have to try, but can't say when that result will be we will get. We have patience. Okay.
In that case, ma'am, line of treatment is Lekhan or Bruhan?
Bruhana. Lekhana already there is Lekhana. Whatever. Isn't
Yes,
right?
ma'am.
Yes. Yes. Endometrial already wash out or what you say decrease amount. Okay. We have to give Artavakshaya dravyas. Okay. If in Maharashtra, Uttar Basti is not allowed in intrauterine. So if in your area, if Uttar Basti is available as a intrauterine procedure, you should try 1 ml and then 2 ml. It's okay. I think in this patient we will got. Yeah.
Uttar Basti by which oil, ma'am?
Kashmiriyadi Ghruta and Lasun tel I have used for one patient which has infertility about 14 years. I have tried for Basti, Anvasan Basti with Lasun tel Anvasan Basti, but she has not got effect for Vandatva. So I had tried Uttar Basti, which is not allowed in Maharashtra, but I take consent from her and tried Uttar Basti. First Uttar Basti for 3 ml we have given her, but 1 ml, I think 1-2 ml intrauterine maybe might be gone in intrauterine cavity. Then the second, it is painful to her, and she got fever. Okay, then now we stopped. But after that, we have given antibiotics and all that for treating a fever, and that I think there will be infection due to our drugs, though they are sterilized and all the safety precaution we had taken. Okay, and after 4 months, she came with conception. Okay, that's why I'm very happy that 14 years infertility case and just 2 Uttar Basti and Anuvasvasti. Before that, we had given her Vetyasat. I think Medo Hara, Google I have used and Vetyasat Dashmul and Gomutra Hartaki. Dashmul Siddha Gruta, Taila, and Gomutra Hartaki we have used for the patient.
Okay, ma'am. Ma'am, what is reference of Kasmaryadi Ghrat from where I get it?
Charak. Charkacharya.
Can I get it in from market or I have to prepare, ma'am?
I think market it is available, but in that cases you have to you have to take precaution about standardization of that gruta, whether it is according to Ayurveda science prepared or not. Some fungal I have seen in that gruta which can't be used in from so many long duration. So we have to prepare fresh gruta. Okay.
Okay. Thank you, ma'am.
Okay, anyone else?
Thank you so much, ma'am. Ma'am, there are no more questions in the chat box, ma'am.
Okay.
Shall I end the question and answer session, ma'am?
Yeah.
Okay, sorry, ma'am. Dr. Pinky has raised her hand again, ma'am.
Okay. Yeah.
Ma'am, and ma'am, go ahead and ask your question, ma'am.
Yeah. Please.
I think she's having some network issues, ma'am. Dr. Pinky? Dr. Pinky, ma'am? Ma'am, can you hear me, ma'am?
Yes, I can hear. You are audible.
But I don't think ma'am I think Dr. Pinky ma'am has some network issues now.
Okay.
Shall we move on, ma'am?
Okay.
Thank you, ma'am.
Now, I invite Dr. Ashwati Ma'am, Associate Professor, Department of Samhita and Siddhartha, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Good evening, everyone. On behalf of Ayurveda College, Coimbatore and Team Diksha, it's my privilege and a great joy for me to extend vote of thanks for today's session. To Dr. Kalpana, going light into the topic Artavakshaya and its Ayurvedic management. I'm sure that the participants are immensely benefited by being here. We are all inspired by your words, madam. Thank you. Thank you so much, madam. Last but not least, I extend my thanks to all our delegates here who are taking part in our session. Hope to meet you all in upcoming sessions also. Thank you, one and all.
Thank you. Thank you.
Thank you, ma'am. Work for cause, not for applause. Live your life to express, not to impress. Thank you all for patiently listening and for the valuable time spent. See you all in the next session. To know more about our updates, please do stay connected with the social media platforms. That's all for today's most interesting session with lots of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.
Thank you.